Thank you, Morten, and good morning, everyone. Yes, so I'm happy to be here to share with all of you what we do in the Novo Nordisk Foundation, not least because of the success of the research that is being done by Jens, most of all, but also a number of other people, obviously. So our headquarters is located here a little bit north of Copenhagen, the picture you can see here. And I'm going to show you what we do to support research within medical science. We do a lot of other activities as well, but I'm going to focus on the work we do to support right from basic biomedical discoveries to clinical translation, and how we do this through strategic partnerships. So it did start more than 100 years ago. And this was before Jens's work, before GLP-1 and so on, but it actually started with insulin. And it was back in 1922 where two scientists, August Krogh and his wife, Marie Krogh, they traveled to Canada to learn how to produce insulin. And when they returned from Canada, they had the permission to manufacture and sell insulin in Scandinavia. But the permission came with a promise, and that promise was that they should give back to society what they earned from this sale. So they created a company. It was called the Nordisk Insulin Laboratory, and they constructed the company in a way that it was actually owned by a foundation, so that they could keep that promise of giving back to society. Shortly after they formed the company, there were actually a couple of employees who broke out to establish a competing company. Luckily, those two companies were reunited in 1989, so that we have what we today know as the Novo Nordisk. And the ownership is actually still what it was in the early days. So, as Morten also alluded to, the Novo Nordisk Foundation that I'm representing today owns the majority of the shares in Novo Nordisk, and also in some of the other Novo Group companies like Novo Nordisk that was formed earlier this year by a merger of Novozymes and Christian Hansen. So the majority of the shares are owned by the Novo Nordisk Foundation, and due to the dividends from those Novo Group companies, as well as the investments that are done by the holding company called Novo Holdings, that kind of invest this money, we in the foundation are privileged to be able to support a lot of activities, not only to support research within medical science, but also, as I'll show you, a number of other activities. And because it's going so well, we heard about that with the GLP-1 success, but we are actually able to give out a lot of money now. It has really expanded, and I hope, it seems from Jens's presentation, that we will keep on being able to grant a lot of money to excellent science. So last year we awarded 1.2 billion euro in the form of 751 grants. So that's really fantastic. So the vision of the foundation is to improve people's health and the sustainability of society and the planet. Very ambitious. We are tied by some bylaws. So due to this promise that was given in 1922, we have some bylaws that state what we can do. So we have 3 philanthropic purposes to support medical research. Also, we support some hospitals and treatment of diabetes in Denmark. And also, we support a lot of other scientific and more humanitarian and social purposes. We also have to ensure that the Novo Group companies are kept in Denmark, and that there is a strong life science ecosystem to sustain these activities. So we recently decided, or the foundation decided on a strategy to kind of fulfill the promise. So we call it the Strategy 2030. It has 3 different pillars. So in the middle, you see what we call the life science ecosystem pillar. So this represents the activities in the foundation that we do to really ensure a strong life science ecosystem in Denmark, but also increasingly in other parts of the world. So we focus on support for fundamental research, also infrastructures and development of new enabling technologies to support this fundamental research. We are very interested in supporting the translation of these basic discoveries into use, clinical, industrial use. And in order for this to be sustainable, these activities, we of course are very interested in supporting educational activities, interest and capacity within the life sciences, right from activities in kindergarten all the way up to university educations. Then we have a pillar in the strategy that focuses on planetary sustainability. It's towards advancing the knowledge and solutions to support the green transition. And then, of course, what we're focusing on here is the health pillar. So we support research, excellent research, and the innovation so that we can prevent some of the global health challenges that we are facing. And the focus within our health mission, if you will, in the foundation is really to prevent and manage cardiometabolic diseases, which is still the #1 killer in the world, but also decreasing the burden and threat of infectious diseases is part of our health mission, and also advancing and applying regenerative medicine. All of these activities is with a hope to reduce inequity in health. So this is our strategy. So how do we then implement the strategy? How do we award grants? So it is, in many ways, a traditional foundation. We have a number of different calls, and these are the majority of the grants that we award are actually given out in open competition. So these are bottom-up researcher-initiated projects that are supported by different type of grants. It's individual project grants, it's collaborative project grants. We also support research leaders in the form of career programs, so right from postdoc, PhD stipends, postdocs, and up to established professors. But we also have another way of awarding grants to support research. So these we call standalone initiative, and they are more kind of strategic, mission-driven initiatives that are kind of guided and developed more within the foundation, but in co-creation with the scientists in the life science ecosystem. So these could be our large research centers that some of you may know of. It's also our academies that kind of award fellowships for both PhD students and postdocs to do basic research or more applied research also within our health strategy. We do all of this in partnerships. We both have a number of public-private partnerships, but of course the non-for-profit research organizations are our strongest partners, you could say. But we also engage with other foundations. You may have heard that we have this tripartite agreement where we try to join forces with the Gates Foundation and Wellcome Trust to kind of have a larger impact with our initiatives. So I want to show you an example of how we address one of our themes within the health strategy. So as I mentioned, the purpose within our strategies is one of the focus areas is really to prevent and treat cardiometabolic disease. And the way we address the challenges of cardiometabolic diseases is really to look at the entire human lifespan. So we have activities that are focused early on, already before conception, in fact. So making sure that we know how to have a healthy pregnancy, that the mothers are living a healthy lifestyle. So we have a number of initiatives to support intervention studies in this space. We also do a number of initiatives that are focused on preventing obesity in children and young and adolescents. So, for instance, we have a research center called Center for Childhood Health, and a number of many more initiatives. So these are just examples. Of course, in order to prevent and treat cardiometabolic disease, we need to understand the pathogenesis of these disorders, and we do support a lot of research projects, and I mentioned some of these academies that award fellowships for younger scientists, but also we have this large center at University of Copenhagen, Center for Basic Metabolic Research that also Jens is affiliated with, where we support research to understand the underlying mechanisms of these disorders or diseases. Then we are also treating cardiometabolic diseases. We support hospitals. I mentioned the Steno hospitals that are treating diabetes patients, but also, of course, doing a lot of research into these diseases. And finally, we also have a lot of new initiatives in the pipeline that are focused on preventing and treating cardiovascular disease, one of course, the comorbidities of the metabolic diseases, and early diagnosis is important. I know that Henrik Sillesen is here. He's been very involved in developing what is now approved as the REACT for early detection of cardiovascular disease, atherosclerosis, and also we have more treatment-focused initiatives underway. So I hope you can see that even though aging research is not spelled out specifically in our strategy, it is actually, to a large degree, already supported indirectly through the approach we have to our health mission. So looking at, in an interdisciplinary way, across the entire healthcare, right from initiatives to support healthy living, research into how we best prevent the development of disease, how we can diagnose these diseases, treat them, and also manage a life with these chronic diseases. So really, in order to do this, it is clear that, you could say that age is actually one of the major risks of developing the cardiometabolic diseases. So indirectly, we are very interested in the changes that occur as a consequence of age. And you all know these hallmarks or drivers of aging that we've seen already yesterday also. But I just wanted to highlight that of course, in order to prevent and treat cardiometabolic diseases and other chronic diseases that occur as a consequence of increasing age, we of course need to understand these underlying molecular mechanisms and hallmarks driving aging. And we have several initiatives. I want to just mention that we recently supported a microbiome health initiative. So this dysbiosis that is important for aging, but also for the development, it seems, of the cardiometabolic diseases. We have an initiative underway, or at least ideas of how we can promote research to address this low-grade chronic inflammation that also Jens mentioned. So this is a very important area for many chronic diseases, not least cardiometabolic diseases. And also we have a stem cell research center, and we've heard about regenerative medicine also yesterday, and it's important to understand how we can kind of have a more implement regenerative medicine in the prevention and treatment of these diseases. So I'll stop here. Time is running. So just to say that even though aging research is not per se in the strategy, we are very interested in the age-related changes, and we need to understand these underlying molecular mechanisms. Thank you.
Thank you so much. Thank you, Marie. That was really fantastic to hear. It's difficult to overstate how important Novo Nordisk Foundation is for the research in Denmark. Actually, it's I think the main funder and driving innovation in Denmark. Do we have any questions for Marie in the hall? There's one down there.
Alexander Fleming, Washington. Well, it is amazing what Novo Nordisk has done. And the question that we have in this room is why just focus on cardiometabolic disease as one of your primary pillars? Why not expand to directly addressing how to increase health span, not just for people with diabetes and obesity and other metabolic risks?
I think, this is, there's been a lot of work going into deciding the strategy. I think if you really want to have an impact, you need to focus your activities to a certain degree. We are fortunate that we can actually support fundamental research very broadly, not only within medical science, but also within the natural and technical sciences. So the board and the foundation has decided that they want to, at the moment, focus their efforts on preventing and treating cardiometabolic disease. It's still a major global health challenge, right? The number one killer is cardiovascular disease, but we know the epidemic of diabetes, and I think there's a need to focus your investments and the work you do, but for sure a healthy aging and long healthy life is of course, I think, one of the benefits of preventing and treating these diseases. But I think it's important to really remember that we do support very broadly activities within medical science. And many of the more fundamental research activities are also, as I just mentioned with my last slide, activities to understand the molecular mechanisms that also drive aging as a process.
I have a follow-up question. So how can we get even more into aging research? How can we persuade? Is this a political? Is it because there's so much focus in the Danish society, I think, about aging and longevity? And how can we make this a research focus of the Novo Nordisk Foundation?
Well, I don't think I'm the right one to answer. I mean, there are some people in the board who makes the final decisions, obviously, but I think it's, with a choice, an active choice to actually support prevention and treatment of cardiometabolic disease, but also infectious diseases and regenerative medicine, I think it has to have the right context, right? I think a lot of the work you do is actually also relevant in these other contexts, so indirectly you can definitely. There may not be a center for healthy aging right around the corner, but I think a lot of those activities are already partly supported.
All right. Well, thank you so much, Marie. That was a really great talk.